Hello and welcome. My name is Barkha Dutt. You're watching the Mojo Story. We continue to be on the road following the COVID pandemic across India, bringing you voices from the ground. At this moment, I'm in the wind-swept city of Ajmer in Rajasthan, where, as you can see behind me, it could rain any moment. But we are looking very, very closely at how the second wave continues to not just ravage the economy, but also its social aftermath. Not many have paid attention to this. The health consequence is, of course, obvious amid doubts and concerns about when a third wave will strike. But there are serious social aftermaths as well. And our special ground report will reveal to you today a disturbing story from the increase in child marriages and the pressure on young girls to get married in this period of the pandemic and the lockdown. But more on that in a moment from now. First, let's take a look at how the vaccinations are looking nationally. Now, this is how we were poised on the 23rd of June in the last 24 hours. The day ended with 64 lakh vaccine doses. Remember, the week started with 86 lakhs. And as of 4:30 p.m. on the 24th of June, that number was at 47 lakhs, and that number, of course, will climb. There have been some concerns about the dramatic variations within states, going up and down in very sharp crests and troughs, very sharp spikes and falls, raising questions about the supply side, amid a new confirmed mutation, the Delta Plus, and forecasts about when a third wave may strike. Some say it could be as early as 6 to 8 weeks away, and others say there is actually no mathematical way to forecast it. Now, let me, as we broadcast live from Ajmer today, introduce our panel of experts as we look at two questions. One, do we know when the third wave will hit? Two, what do we know about the Delta Plus? And three, what do we know about the vaccines vis-a-vis both the Delta and the Delta Plus? Let me introduce our guests one by one. We're joined by Dr. Bajan. Let's welcome him to the program. Khusrav Bajan is a member of the Maharashtra Task Force. The Maharashtra Health Minister has only today signaled a concern that Maharashtra's cases are not falling below 8,000 at a daily count, and he's concerned about that. Maharashtra is concerned that the Delta Plus could trigger an early third wave. We're also joined by Dr. Vineeta, one of our foremost scientists, one of our best regarded scientists. Welcome to the program, Vineeta. And Dr. Arvinder Soin, who has not just been at the front line of the COVID battle, but has been relentlessly calling for vaccines, and more vaccines. And I'm going to discuss mutations and vaccines, the virus versus vaccination battle with all of you in just a moment. But we continue to, as you can see on this very windy day in Rajasthan, look at the very grave social consequences of this virus, which is often hidden away from our public debates, from our primetime debates. I discovered traveling through Rajasthan that in these 15, 16 months, because of the consequences for the economy, because work has been locked down, because husbands and wives and children have been hunkered down at home, because schools are in fact not open, because of that, we actually see an increasing pressure on young girls to get married. This is the story of one such home where three girls below the age of 17, the youngest is 15, all three are sisters. They managed to stand up and cancel their wedding. And this is how they actually hit back. But not all girls are as lucky. One of the untold tragedies of the COVID-19 pandemic has been that as it pushes more and more families into financial hardship and also pushes more and more girls out of the school system, there has been a distinct increase in the incidence of child marriage. As families find it difficult to make ends meet, they're in fact putting pressure on young girls not yet 18 to get engaged and even get married. In villages like this one, in Hasyavas, in Ajmer, there is a constant tussle between young girls and the village elders. और लड़कियां बोलती हैं हमारे और भी सपने हैं हमें अभी शादी नहीं करनी, हमें आगे और कुछ करना है, बहुत कुछ करना है, लेकिन कोविड के टाइम हम देख रहे हैं कि ये जो मुश्किल है हमेशा से रही है, लेकिन इसके जो इंसिडेंट्स हैं वो बढ़ रहे हैं। मेरे साथ यहाँ पर सपना है और सपना की उम्र 17 साल की है और वहाँ पे अगर आप देखें तो आप देखेंगे कि उन बच्चियों में से जो ऑरेंज टी शर्ट में है वो सपना की बहन है मोनिका, और उनसे भी हम बात करेंगे। और यहाँ पे बहुत सी ऐसी लड़कियाँ हैं, लेकिन मोनिका और सपना की कहानी से आज हम शुरू करते हैं जिन पर ये दबाव है। और दबाव है क्या, उनके साथ सगाई हुई भी, शादी की डेट भी तय हो गई, 1 मई की उनको शादी होनी थी, लेकिन उन्होंने अपना हक असर्ट किया और उन्होंने कहा नहीं, हम ये नहीं करना चाहते। तो सपना बताइए कि किस तरह का दबाव हुआ, क्योंकि आप मुझे बता रही थी कि आपकी तो सगाई भी तय हो गई थी। क्या हुआ?
मैं जब हमारे भैया है 21 साल के हैं वो, तो उनके ससुराल से ये दबाव आ रहा था कि हम ये शादी करेंगे भाई की। तो मेरी जो हमारी जॉइंट फैमिली है, तो जो मेरे बड़े पापा हैं उन्होंने बोला था कि मैं अपनी बेटों के साथ ही शादी करूँगा। तो हम 3 बहनें जिनकी शादी नहीं हुई है। तो मेरी
और आपकी 3 बहनों की उम्र क्या है? आप 17 साल की हैं,
एक और मेरी
और मोनिका की उम्र है 15 साल, और जो सबसे छोटी है?
नहीं, वो सबसे बड़ी है।
अच्छा, हाँ, अच्छा।
तो वो मेरे बड़े पापा की लड़की है, वो भी 17 साल की है। हम दोनों साथ ही BA फर्स्ट ईयर में है। तो उसकी सगाई पहले हो चुकी थी। और मोनिका की हमारी एक दीदी है, उनके देवर के साथ घर वालों ने बोला था कि हम कर देंगे। तो मोनिका की फिक्स थी। मेरी सगाई इसलिए नहीं हो रही थी क्योंकि जो मेरी मम्मी है वो मेरे लिए लड़ाई कर रहे थे कि मैं अपनी बेटी की सगाई ऐसे वैसे नहीं करूँगी, क्योंकि ये बहुत इंटेलिजेंट है और मुझे इसी के लायक लड़का।
अच्छा, ये तो बहुत अच्छी बात है कि जो मम्मी है वो लड़ाई कर रही थी कि अभी नहीं मेरी लड़की की शादी होगी, है ना?
हाँ, तो उन्होंने बहुत सारे रिश्ते आए थे, उन्होंने रिजेक्ट करे थे मेरी मम्मी ने, ताकि मेरी शादी कैसे भी करके कैंसिल हो जाए। बट जब लास्ट में बड़े पापा ने ऐसे बोला कि अब तो करनी है, तब उन्होंने एक रिश्ता आया था, तब उन्होंने हाँ बोल दी थी।
जब आपको ये पता लगा कि आपकी सगाई हो गई है और इस तरह से बात चल रही है, तो आपके मन में क्या आया?
मेरे मन में ये पहले से मेरी ये थी इच्छा कि मैं शादी नहीं करूँगी, क्योंकि मुझे ऐसा लगता है शादी करने के बाद बहुत बंधन आते हैं और जो हमारी आइडेंटिटी है वो खो जाती है। तो मैं अपनी खुद की पहचान बनाना चाहती हूँ कि लोग मुझे मेरे नाम से जाने, मेरे घर वालों के नाम से नहीं जाने, ना मेरे ससुराल वालों के नाम से। मैं खुद अपनी आइडेंटिटी बनाना चाहती हूँ। तो मैंने इसलिए सोचा कि मैं शादी नहीं करूँगी। लेकिन जब मैंने सुना कि मेरी शादी हो गई, मेरी सगाई हो गई है, तो मुझे ऐसा लगा कि मैं टूट चुकी हूँ। जो मेरी इच्छाएं थी वो सारी मेरी निकल चुकी है। तो मैं तीनों बहनें हम साथ में बैठ के बहुत रोते थे कि हमारी सगाई हो रही है। मैं अपने जो बड़े पापा उनके हम डायरेक्टली नहीं बोल सकते थे, हम बहुत डरते हैं। तो मैंने अपनी मम्मियों को, अपनी बड़ी मम्मियों को ऐसे बोला था, जैसे ऐसा होता है कि पहले हाई कोर्ट में फिर सुप्रीम कोर्ट में अपील दी जाती है, वैसे हम अपनी मम्मियों को बोलते थे। और
तो आपकी मम्मी थी हाई कोर्ट, और उसके बाद सुप्रीम कोर्ट कौन थे? बड़े पापा, जिनसे आप डरते हैं डायरेक्टली बात करने के लिए, है ना? हाँ, फिर
बाद में बड़े पापा को बोलने, हमने अपनी बड़ी मम्मी को बोल दिया। हमने सोचा कैसे भी करके बात ऊपर तक तो पहुंच जाएगी। तो फिर जब बड़ी मम्मी ने ऐसा बोला कि लड़कियां बोल रही अभी हमारी शादी मत करो, और वो ऐसा भी, मतलब हम ऐसा बोलते थे उन्हें कि गांव में हम जहाँ चाइल्ड मैरिज होती है वहाँ खाना खाने नहीं जाते हैं और हम उसके विरुद्ध काम करते हैं। तो जब हम अभी 18 के नहीं हुए, हमारी शादी हो जाएगी, तो लड़कियां ऐसे बोले कि जो खुद मिसाल थी चाइल्ड मैरिज को रोकने के लिए, आज उन्हीं की शादी हो रही है, तो हम क्या चीज़ है। तो हम चाहते थे कि शादी ना हो। तो बड़ी मम्मी ने मेरे बड़े पापा को ऐसा बोला था, तो उन्होंने कहा कि नहीं, मैं तो करूँगा शादी, क्योंकि फिर तो खर्चा भी हो जाएगा साथ में। और एक ये कि वो ये मानते थे कि समाज में जो लोग हैं वैसे बोलते थे कि लड़कियां बड़ी हैं आपकी, तो आप शादी कर दीजिए।
एक बात समझाइए, क्योंकि बहुत से जो शहरों में लोग रहते हैं वो शायद ये समझ ना पाए। अगर वो सवाल उठाएं कि कोविड से, लॉकडाउन की वजह से जो एक तरह से ये दबाव कैसे बढ़ा है, क्या ये इसलिए बढ़ा है क्योंकि पैसों वगैरह की भी परेशानी हो रही है और बहुत सी लड़कियां जो हैं वो स्कूल या कॉलेज नहीं जा पा रही क्योंकि सब कुछ बंद पड़ा है?
वो एक ऐसा था कि जो मेरे भाई के ससुराल वाले हैं, उनकी मम्मी है वो अभी लॉकडाउन में बीमार हो गई थी, और एक वो है कि उनके वहाँ से लड़कियों की पढ़ाई छूट गई थी क्योंकि लॉकडाउन में उन्हें लगा कि स्कूल नहीं खुलेंगे। तो उनकी बेटी की पढ़ाई भी छूटने वाली थी, मतलब हमने बोला कि पढ़ाइए, अब तक उन्होंने पढ़ाया था। तो उन्होंने बोला कि मैं अपनी बेटी की शादी करूँगी, तो आपको भी आपके बेटे की शादी करनी है। तो फिर पापा ने पहले ही सोच रखा था ये कि हम चारों बहन भाई साथ में करूँगा मैं शादी। तो फिर इसलिए उन्होंने ही शादी करने के लिए बोला था। लेकिन जब हमने बोला कि हमें नहीं करनी, हमें मतलब अभी कम से कम पोस्टपोन ही कर दो आप, हम जब 18 के हो जाए तब बाद में कर देना। तो उन्होंने पहले बोल दिया कि मैं नहीं करूँगा। फिर उसके बाद में उन्हें ऐसा लगा कि शायद लड़कियाँ सही बोल रही है। और
कितना लड़ाई करना पड़ा?
हम 2-3 महीने तक हमने बहुत लड़ाई की अपने पापा से।
तो सपना और मोनिका को 2-3 महीने यहाँ लड़ाई करनी पड़ी कि भाई 18 की उम्र से कम पे शादी ना हो। ये बताओ कि ये भी तो थोड़ी ना है कि 18 की हो जाओ तो एकदम शादी करना चाहते हो, आपके और भी सपने होंगे। आपका क्या सपना है?
मेरा एक तो ये सपना, मैं फुटबॉल खेलती हूँ तो मेरा एक सपना है कि मैं फुटबॉलर बनूँ और अपने जो आसपास जो लड़के नहीं खेल पाते उनको मैं टीचिंग दूँ। और एक ये है कि मैं IAS ऑफिसर बनना चाहती हूँ।
अच्छा।
तो मैं इसके लिए बहुत पढ़ाई करती हूँ। तो अपने घर वालों में मैंने ऐसा बोला है कि मुझे पढ़ाई करने दो, एक IAS ऑफिसर बनने दो, फिर आप शादी कर लेना। बाकी मेरे मन में ऐसा था कि मैं बन जाऊंगी तो कौन मेरी शादी करेगा। लेकिन
मतलब एक बारी आप खुद पैसे कमाना शुरू कर दें और आप अपनी एक इंडिपेंडेंस ले लें। हाँ। तो फिर तो आपका ही फैसला होगा। हाँ, है ना कि क्या करना चाहते हैं।
मतलब हमेशा यही बोलती हूँ कि एक बार मेरी जॉब लग गई तो फिर आप लोगों को दिखा दूंगी मैं। पर मेरे मन में ये था कि मैं बस फ्रीली रहूँ और जो मेरी बहुत सारी इच्छाएं हैं, मुझे बहुत घूमना है बाहर और अपने मम्मी को भी घुमाना है, क्योंकि मेरी मम्मी मेरी तरह है, वो स्पोर्ट्स में उनका बहुत इंटरेस्ट है। अच्छा। तो मैं चाहती हूँ कि मैं उन्हें सारी दुनिया दिखा दूँ और वो खुद गेम खेले। और
मम्मी की शादी कितनी उम्र पे हुई थी?
वो जो 14 साल के थे।
तो अब आप ये देखिए कि कैसे औरतें एक जनरेशन से दूसरे जनरेशन अपनी बेटियों के लिए लड़ती हैं। इनकी मम्मी का नाम क्या है? कृष्ण देवी की शादी 14 साल की उम्र पे हुई थी। तो ये चाहती हैं कि मेरी बेटी के साथ कम से कम वो ना हो। और आप यहाँ देखें तो आप देख सकते हैं कि बहुत सी बच्चियाँ हैं इस गांव में, और आप देखेंगे कि इस गांव में जो सोशल एक्टिविस्ट है उन्होंने एक तरीका ढूंढा है लड़कियों को अपने पैर पे खड़े होने का, उनको एक फोकस देने का, और वो तरीका है फुटबॉल। पढ़ाई भी है, इकोनॉमिक इंडिपेंडेंस भी है, पर ये जो फुटबॉल है इससे लड़कियों को क्या कॉन्फिडेंस मिलता है, ज़रा इसके बारे में बताइए।
पहले ये था, मैं जब 8th क्लास में थी मैंने फुटबॉल ज्वाइन नहीं किया था, मेरी बहनें वो जाती थी तो मैं उन्हें देखती थी। तो मतलब जब घर वाले ऐसा बोलते थे, शॉर्ट्स पहनती थी तो ऐसा बोलते थे कि क्या पहन रहे हो तुम लोगों ने, गाँव में अच्छा नहीं लगता और बाहर खेलने जाती हो बहुत बेकार लगता है ऐसा। तब दीदी की वजह से, महिला जन अधिकार समिति की दीदी आती है, तो उनकी वजह से घर वालों ने हाँ बोल दिया था जाने के लिए। फिर उसके बाद जब हम वहाँ जाते थे, शॉर्ट्स के अंदर जाते थे और वहाँ पे गेम खेलते थे, तो ऐसा लगता है कि स्पोर्ट्स से मतलब कॉन्फिडेंस बढ़ता है। तो वैसे हमारा एक कॉन्फिडेंस बढ़ा था कि हम यहाँ पे जैसे लड़के कोई नहीं खेलती, हम खेलते हैं, वैसे ही हमारा धीरे धीरे कॉन्फिडेंस बढ़ने लग गया। और फिर उसके बाद में हम अपने लिए लड़ाई कर सकते हैं। हम पहले बाहर जाने के लिए हमें मम्मी को पटाना पड़ता था कि मम्मी पापा को बोल दो, लेकिन अब हम कैसे भी करके बड़े पापा को मैं बात बोल देती हूँ। हम तीनों में जब भी फुटबॉल के लिए कैंप होता है अजमेर में, तो हम पहले तीनों डिस्कस करते हैं कि कौन पापा से बोलेगा। फिर उसके बाद में मैं धीरे से जाके पापा को, जो हमारा वो एग्रीमेंट लेटर होता है उसमें पापा का साइन करवाना होता है, तो पापा को जाके दिखा देती पापा ये लो, पापा फिर पढ़ लेते खुद ही, फिर वो बोल देते पापा फुटबॉल कैंप पे तो जाना, आपको साइन कर दीजिए।
अब आप सोचिए कि हम अपनी फ्रीडम्स को किस तरह फॉर ग्रांटेड टेक करते हैं, क्योंकि यहाँ पे इस गांव में लड़कियों को कितना नेगोशिएट करना पड़ता है फुटबॉल खेलने के लिए। अच्छा ये बताओ, आपने तो अपनी मनमानी करा ली, आपने अपनी सगाई, तो क्या सगाई कैंसिल हो गई है कि सगाई अभी भी है?
नहीं, सगाई अभी भी है।
तो फिर क्या होगा? अभी के लिए पोस्टपोनमेंट है। हाँ, मतलब कैंसिल नहीं हुआ?
नहीं, कैंसिल नहीं।
और जिस लड़के के साथ आपका रिश्ता किया था उससे कभी मिली आप?
नहीं,
मिलना आप चाहती भी नहीं है क्योंकि आपको इंटरेस्ट ही नहीं है। ठीक है, तो अभी तो सगाई जो हुई है वो कैसे आप कैंसिल कराना चाहती है ना?
हाँ, मैं चाहती हूँ कैंसिल।
तो क्या प्लान है उसके लिए?
उसके लिए बस मैं यही सोच रही हूँ, मैं बहुत पढ़ाई कर रही हूँ अभी कि मैं कैसे कोई पहले छोटी सी जॉब में चली जाऊँगी ना, तो मेरे घर वालों को लगेगा हाँ ये इंडिपेंडेंट है, तो फिर उसके बाद में मैं शायद अपना फैसला ले सकूँ।
बहुत अच्छी बात है। एक मैं आपसे और चीज़ पूछूंगी कि आप तो स्ट्रॉन्ग हैं, बहुत सी लड़कियां शायद इतनी स्ट्रॉन्ग ना हो, या उनके पास एक मम्मी ना हो जो उनके लिए लड़ने के लिए तैयार हो। तो आपकी जो सहेलियां हैं यहाँ गांव में, बहुत सी लड़कियों पे ऐसे इस तरह की सगाई या शादी हुई है या दबाव है?
हाँ, बहुत सारी लड़कियां जिन पे दबाव आया है। एक लड़की थी जिसकी सगाई होने वाली, तो उसने बोला था कि मैं उस फैमिली को देखना चाहती हूँ, उस लड़के को देखना चाहती हूँ कि वो कैसा है। तो वहाँ पे कुछ फंक्शन था, तब हम सब साथ में गए थे। हमने कहा कि ना इसको भेज दो आप और हम देखने के लिए आ जाएंगे, इसमें क्या प्रॉब्लम है। फिर उसके पापा को उसने ये भी बोला था मैं पुलिस को फ़ोन कर दूंगी, अगर आप लोगों ने वैसे सगाई कर दी फिर आप तो शादी कर दोगे, फिर ससुराल भेज दोगे। तो उसके पापा ने कहा यार अभी रहने दो, हम बस सगाई कर रहे हैं, शादी नहीं करें। तो उस लड़की को हम वहाँ पे लेके गए थे, उसने वो घर भी देखा और लड़का भी देखा। फिर उसने मतलब उसे पसंद
कम से कम उसको लड़का देखने को तो मिला। लेकिन आप ये कह रही हैं लड़का कैसा भी हो, आपको इसमें अभी कोई इंटरेस्ट नहीं है, अभी तो उम्र भी नहीं हुई, बहुत और चीजें करनी है जिंदगी में, है ना। तो ये है सपना की कहानी। और सपना की मतलब ये सिर्फ सपना की अकेली कहानी नहीं है, सपना की बहन को भी इसी तरह लड़ना पड़ा, है ना। और गांव की बहुत सी लड़कियों को इस तरह से लड़ना पड़ रहा है। लेकिन आप ये सोचिए कि कोविड के टाइम हो क्या रहा है। हो ये रहा है कि स्कूल्स बंद पड़े हैं, बहुत से लोगों के पास वाईफाई इंटरनेट है नहीं, जो ऑनलाइन क्लासेस हैं वो नहीं हो पाती, लोगों के जो परिवार है उनको काम मिलने में भी मुश्किल हो रही है। तो जो एक पहले से प्रेशर था वो प्रेशर अब और भी बढ़ रहा है। आप एक आंकड़ा सोचिए, कंसिडर वन स्टेटिस्टिक, इन द August of 2020 alone there was, according to a reply to an RTI, an 88% increase in that month in the incidence of child marriage compared to the previous August of 2019. And in 2020 the government and the government's agency Childline says that it received close to 6,000 phone calls on its helpline that were pleas for help from girls who did not want to get married before it was their age and before they are able to pursue their other dreams.
Okay, we tend to look at COVID and the first wave, the second wave, and the third wave only in terms of vaccinations and of course lives lost. But it is a very insidious virus that is actually changing the way our society, our social mores, our thoughts, our notions of human dignity are organized. And that is among the most disturbing reports I have covered, as I see young girls being pushed out of the school system into marriages before they're 18. So I think it's always important when we talk medicine to also remind our audience that there are real families, real people, real tragedies, and this time it's hitting our children in ways that we couldn't even imagine. Let's come now to the subject of our conversation today, the Delta Plus, and what we know about the third wave, if we know anything at all. I'd like to start with you, Shahid Jameel, if I may. There have been multiple forecasts about when the third wave will hit. The All India Medical Chief, Dr. Guleria, seems to think between 6 to 8 weeks, maybe even earlier. Maharashtra is now worried that the Delta Plus variant will bring it on early as well. Is there a scientific basis to calculate when it may hit?
No, Barkha, I don't think there is any scientific basis. And if I may say, I think Dr. Guleria's statement has been taken out of context. He said that if people don't follow COVID appropriate behavior, then we may be seeing a third wave in about 6 weeks. I have no idea how we arrived at the figure of 6 weeks and not 5 weeks or 8 weeks, but nevertheless, I think he did qualify with that statement. Now, coming to whether there will be a third wave, the magnitude of that wave, or when it will come, whether it will come or not, will depend on, in my view, three things. The first, of course, is behavior. Are we masking up? Are we avoiding crowded places as the country is opening up? The second is the density of vaccination in the country in the next couple of weeks. And the third, obviously, is if a new, more infectious variant emerges. Now, there is no evidence so far that Delta Plus is going to be any more infectious than Delta already is. So based on this, I think it will depend. So my view is that if we continue to vaccinate well, and if we as individuals, follow appropriate behavior, then we may not even be looking at what we call a third wave. There may be isolated outbreaks here and there. So that's it.
But the caveat that you had was if we vaccinate well. Do you believe, of course, the 86 lakh vaccinations was a great start, but and right now we're holding decently, but we're not holding, Shahid Jameel, at the number that we need to vaccinate all adults by December, and that number would be 9 million. We've also seen some inexplicable dramatic variations within states Madhya Pradesh, for example, has been discussed, where we went from 692 to 16 lakhs to 5,000 to then 7 lakhs, with Madhya Pradesh saying, hey, we don't vaccinate every day. Andhra Pradesh had the opposite trajectory, actually falling down. Does the vaccination level convince you uh, that actually we don't need to be terrified of an imminent third wave, national third wave?
Well, Barkha, I wish every day was yoga day, and then we could vaccinate 8 million people a day. But to be serious about it, I think supply of vaccines is an issue right now. But I think this supply is going to get sorted out in the next couple of weeks. What the vaccination on Yoga Day showed very clearly is that we do have the capacity to vaccinate 86 lakhs people a day, and that to me is no mean achievement. So I feel that as enough supply comes through, we will be able to vaccinate at scale. So supply is the real issue right now. So one hopes that that will sort out in the next few weeks.
So you're not very convinced. You're not very convinced of modelers. For example, IIT Kanpur saying the third wave will peak between September and November. We've had the Maharashtra task force making its own sort of prediction, and we'll take that to Dr. Bajan in just a moment. Shahid, Jameel, you're actually saying there's no science right now that tells us not just when, but if a third wave will come at all.
Well, Barkha, my view on models is that all models are wrong, but some models may be useful. Any model depends upon the input data. And I think the data that has gone into making models in some ways is flawed. Uh, Dr. The person who's the head, I'm forgetting his name, of the supermodel. He himself said that the data available to him for the second wave made them predict 1.5 or rather 150,000 cases a day. But we reached more than 400,000 cases a day. So that kind of shows you that if you work with insufficient data, if you work with data that is compromised or flawed in some way, then your model outcome is also going to be flawed. A model is basically based on data available and the assumptions that you make to generate that model.
Right. Yeah. So, I mean, the good news that I hear in your sentences, and I'll push you on it a little bit later, is that there may not be the third wave of the kind that we experienced in the second wave. We've got Dr. Vincent Rajkumar from the Mayo Clinic in the US joining us. Early morning for you. So, good morning and thanks for waking up. What do you make of the Delta and the Delta Plus? I know it's causing some concern in the US.
That is right. I totally agree with what Dr. Shahid just said, that we have no data right now that the Delta Plus variant is going to be any more serious than the Delta already is. The reason for the concern is that it seems to have a mutation that was seen in the South African variant, and whether that will impact vaccinations efficacy. But I think we just keep it in mind that we already have a problem with Delta variant and try to deal with it. Cases of Delta variant are increasing rapidly in the UK and in the US. In terms of doubling time, how many cases are we seeing? Those numbers have gone up fourfold in the last month in the UK and twofold in the US. But in both countries, because half the population is fully vaccinated, the total absolute number of cases is still quite low. I think the path forward is very, very clear for India. Whether there is a third wave or not depends on the public behavior. If everyone wears a mask and social distances and avoids crowds, and we continue the same pace of vaccination, the third wave may be significantly muted. Partly also because we had a devastating second wave, which hopefully gave immunity to a sizable chunk of people. So just keep it up, be positive. No need to think doom and gloom, but absolutely have to be careful. Unless you're vaccinated, you're going to assume that you're going to get Delta variant tomorrow. That's the only way to behave. You're going to get COVID unless you're vaccinated. And so I'm going to be safe.
Okay, but the point is that the way our cities are opening up, Arvinder Soin, is not exactly model behavior. People are masked, yes, but people are also congregating in huge numbers, whether at malls or in bazaars. There is obviously a sense of frustration at having been locked in for so long. So that's the kind of reaction you're seeing. The other question, Dr. Soin, is this: a huge debate over one vaccine versus two doses, what the gap should be. Also, AstraZeneca versus Pfizer. We have today a statement saying Covaxin, which has just received its approval by the expert panel for its phase 3 data. It'll be used to vaccinate children, but we still don't have its phase 3 data in the public domain. That's point one. We have Pfizer saying that it works quite well against the Delta, but we don't have Pfizer in India. We have Covishield, which we know from a United Kingdom study gives you 33% protection against infection and a little over 70% against hospitalization. And the 33% protection is against symptomatic infection. So asymptomatic could be larger, which means that somebody could have COVID, not know it, be a vector. So what happens between these two doses? Because we simply don't have enough vaccines for a two-dose vaccine strategy.
So you asked me two things. Let me first talk about COVID behavior violations that are happening every day, and obviously that is very distressing, especially after the ravaging second surge we've had. We're just kind of getting over. It's still not over. Still about 50,000 cases a day. So, and that's exactly the reason, Barkha, why models which have been inaccurate so far will continue to be inaccurate. So you can't really trust models because the models cannot predict human behavior. And human behavior is, unfortunately, is at its abysmal low at the moment. And nobody is really paying attention to how to wear masks, double masking or even masking properly, because they've half the people have got their masks dangling around their necks or definitely not covering their nose. So that's one, and they're congregating like there's no tomorrow. So those two things are the reasons exactly why we cannot predict when the third wave will happen. But what we can say is it will happen, because this is the way we're going to behave. There's definitely going to be a third wave. Now, the only thing that can actually flatten it out is, of course, rapid vaccination. We've all said that. Now, let's talk about vaccination. Amidst all these papers that have been published about one dose, two dose, Delta variant, and other variants, and the vaccine effectiveness against them, it's pretty clear that two doses of Covishield and Pfizer and Moderna and Covaxin protect against severe disease and death, even with the Delta variant. So let's just first look at that truth. The second thing is we're worried about the gaps. Now, UK has actually published the studies where a gap of 8, 10, and 12 weeks was better than less of a gap. And that's the reason we went to the extended gap. Also, because logistically it suited us, we didn't have enough vaccine. But UK is reversed back to 8 weeks for the elderly. And we can do that when we have enough vaccine. But if we don't have enough vaccine, then it's much better, probably, to cover a large section of population partially than protect a smaller population completely. So I think that's where we are at the moment. We should try and get to the two-dose stage for everyone, at least all adults. As far as the Pfizer and the Covaxin for children are concerned, I hear Pfizer is going to come in soon. We've been hearing that for the last few months. But if it does come in, then 12 to 18-year-olds can be preferentially covered with that. And Covaxin trials are now underway, and we should have results in August. And hopefully between August and October, we will have a massive drive for children. As far as the third wave itself is concerned, I think that probably October, November would be my guess, and that's based on the waves in other countries. And the first two waves in the world itself, I mean, if you look at global numbers, then there was a space of 3 months between the first and the second peaks. So that's the average. But there are countries that have had it in 2 months, there are countries that have had it in 6 months, and the obvious answer is behavior, vaccination, variants.
Yeah, so I don't disagree with any of this, but I'm just not yet as optimistic as you, Arvinder, about the supply side on the vaccines. Shahid, a brief interjection before I go to Vineeta, because you're the only one who actually thinks a third wave is not inevitable. It has been called inevitable literally by everybody else. And to say everybody should mask up, everybody should be vaccinated, of course, yes. but we know that everybody is not masking up, and we know that there aren't enough vaccines to even necessarily vaccinate all adults by December on a single dose. Forget 2 doses.
Yeah, so Barkha, it's not that black and white. I mean, my arguments have a lot of gray areas in them, and all I'm saying is there are 3 things to be done: COVID appropriate behavior, vaccines, and variant. Variant we have no control over. Vaccines and behavior we have some control over. One at the individual level, the other at the public policy level. So let's try to do the best we can. But I think we are getting overly worried about when the second wave will come, how big it will be. Various people are making various predictions without any data to back it up. So all I'm saying is don't worry about that, but worry about behavior and worry about vaccines.
Fair
That's
enough.
all I'm saying.
That's a commonsensical, but it's common sense enough to fend off, this world of mutations. Dr. Vineeta Bal, if I can get you in, the science is actually, for a layperson, this simple. The more the infections, the more the chances of the virus mutating. So it is important actually to have fewer infections. Now, this is where I worry slightly about the single dose, because yes, our priority has to be to not hospitalize people. But if in the process we have a large number of infected people, symptomatic or asymptomatic, please correct me if I'm wrong, isn't there more danger of more mutations?
Well, yes, in principle, yes. More the number of people who that are infected, and chronicity to some extent of the infectious stage, then yes, the mutations will go up. But this particular virus hasn't been as prone to infections as some other RNA viruses are, and that is why we have a little more hope that despite infections spreading further, we may not have a major disaster in hand. I understand that between Delta and Delta Plus, there has been a mutations. These mutations will continue for sure. But I think the public policy, so what is good for the larger population and what is good for the individual, this was the point that Shahid was also making, others were, Dr. Rajkumar was also making, and that point is critical. Can we increase the availability of doses in India overnight? No. Even if we increase it, can we actually vaccinate everybody so very rapidly? No, we don't have manpower, trained manpower also. So we have to have a reasonable compromise which has some rationality, some science. So it has to have immunology, virology coming into picture as well as public health coming into picture. And from that perspective, I don't see that giving 2 vaccine shots to a small number of population is going to be the best option. I think covering larger number of people so that hospitalization decreases is important. And Covishield data, AstraZeneca data has already shown this, that the hospitalization rates will come down very significantly even with a single dose. So I think that's the best option that we have currently. It's a compromise, but it's the best compromise I think we can have.
What heartens me is that all of you are sounding quite non-alarmist about this third wave. But out of Maharashtra, Dr. Bajan, we've had different signals. We've had Maharashtra's health minister only today say that he's terribly concerned that the daily count is not falling below 8,000 in Maharashtra. He's terribly concerned about the Delta Plus variant. The task force of which you are a member seems to have expressed the concern that the Delta Plus mutation could trigger an early third wave. Your task force has also spoken about how the third wave could hit children, which has been contested by many other experts. But you've stuck to that claim. And we've had the first death, officially recognized death in Madhya Pradesh from the Delta Plus. So I just wanted to bring everybody up to speed on that. Go ahead, Dr. Bajan.
Yeah, hi Barkha. So I basically agree with most of the panelists on most issues. definitely we should also talk about the thick tail that we have of the waves rather than only talking from wave 1 to wave 3. We did see in the first setting also in the first wave that we had a very thick tail. So our numbers definitely rapidly declined, but then they stood there for a month or two. And same thing is happening in the second wave. So this thick tail is a bit of a concern. And then suddenly we are worried about the third wave coming on because of the variants that we have seen. Yes, we are worried about the Delta wave, but we are also worried about the Delta plus wave. But I would say that we should not be so worried about the Delta plus because we don't have much scientific data on it. We have had only 40 cases all over India, and these 40 cases have emerged out of 45,000 that have been actually checked on genomics done on them. So we do have a problem, but we do not foresee a major problem with the plus variant. Yes, having said that, the Delta variant, the less vaccination that we have done are all going to be responsible, and the COVID inappropriate behavior for the third wave. I have a problem with the models that we have been talking about, the Kanpur model, etc. They themselves have given 3 models of 2 lakhs, 3 lakhs and 5 lakhs by September, October. And this is a flawed model in my view because they have not taken vaccination into account. So being optimistic, we in Mumbai, we are vaccinating 1 lakh per day, and this is third day in a row. And if we vaccinate more than 1 crore in India, I think we should achieve good vaccination strategies by the end of November, December. And that's the only way, along with good COVID appropriate behavior, to try and delay the third wave and get more people vaccinated. I also can talk from the Maharashtra task force, what we have done to try and circumvent the third wave. And that would be that we have not only looked at the things which are mentioned, like vaccination. So we've improved vaccination centers, private, public. We have also tried to look at the sources which were not available, like oxygen, etc., in the second wave. So we do not want deaths because there is lack of remdesivir or oxygen or anything. So we've made a list of what is absolutely mandatory and what is not so mandatory, and we have made sure that we would have enough stocks of those modalities like oxygen, beds, etc., the infrastructure during this locking time, that we
Right.
would be ready for the third wave.
But the Maharashtra task force, before I go to Vincent, has given a timeline. What is the timeline that the Maharashtra task force has given for preparing for a third wave? I know you don't agree with the models. What's your own estimate?
Yeah, so basically the third wave, some say that Kerala has already started the third wave. So we cannot actually label a little rise in the cases as the third wave, but what we need to do is be prepared for it. So no one here or anywhere would be able to actually give you a time frame. And it could be anything from 3 weeks from now till November or December, because the Stanford model actually told us November, December would be the third wave. So I don't think we should look at a timeline here, but we should make ourselves extremely prepared to try and prevent it and then try to tackle it if it does come.
Okay, let me just take another quick round of comments. Dr. Vincent Rajkumar, the international commentary on the Delta variant, not the Delta plus, is quite different. There is a lot of concern. The United Kingdom, in fact, is already declaring a third wave based on the Delta variant alone, right? So very few fatalities on a relative scale, but the number of infections have gone up, and all of them seem to be this Delta variant. We're also seeing some early research that suggests that the Delta plus resists the game-changing antibody cocktail that was seen to work quite well in the early stages of the Delta. So just your thoughts on why the Delta is causing so much anxiety in the US and the UK, which are countries where more than 50% of the population is vaccinated.
Everybody's worried about what happened in India. And everybody's worried that the speed at which people got infected, the speed at which transmission as well as disease severity progressed, worries everyone that, we have vaccinated people, but in spite of 50% of the US being vaccinated, that still means another 100 million people have not been vaccinated. And some are reluctant to get a vaccine. And so we are just concerned that if the Delta variant arrives here, as it almost certainly has, that people who are either unvaccinated or people who have had vaccination but due to immunosuppression or chemotherapy or very elderly state have not mounted a sufficient antibody response are all vulnerable. And given what happened in India, we don't want to lose lives. And that's why we are just so keen on encouraging people to get a vaccine when, unlike India, the countries UK and the US have abundant supply of vaccines, and we still haven't vaccinated, a huge chunk of population who are eligible for the vaccine. I would want to make one other comment that I agree so much with all the panelists, both in terms of like the optimism and the fact that we do have some elements in our control. That is the CMC Vellore study, which was on healthcare workers with 10,000 plus healthcare workers, 80% of whom had been vaccinated. I spoke to the director of CMC Vellore. I know the data well because we published it in the Mayo Clinic proceedings. One dose was sufficient to prevent ICU admissions, oxygen need, and preventing deaths. So I think a strategy of getting as many people vaccinated with at least one dose that many of your experts have said, I really fully support it. And people have tried to corner me into saying, oh, it's only 33% effective against symptomatic disease. It's a very hard judgment call.
Well, that's what the UK study. But that's what the UK study says.
Yes, it did. But it also said that with two doses, even with one dose, severity, hospitalization, the need for hospitalization or ICU is significantly reduced, and there's still efficacy. Every COVID case in India is due to the Delta variant. So I think you need to look at what we have in terms of data, which says that even in the periods of February, March, April in Vellore, healthcare workers who are there in the field, one dose was highly protective against needing ICU, needing oxygen, or dying from COVID. I think if we had abundant supply, no question, everyone should get 2 vaccines. I'm urging everybody to get 2 vaccines. But
right.
Given what we have, COVID-appropriate behavior and 1 vaccine for as many people as possible, and this speed at which it's going in the last few days, I'm so optimistic we can at least make the wave into a ripple.
Well, I just want to say that I can't prove this through data, but through the second wave, we did see many deaths among those who had a single shot. What we don't know is what is the gap between when they'd had the shot and when they got the infection, because there is, of course, you need, 6 weeks for the vaccine to be effective, or 4? Someone help me here. Is it 6 or 4? Anyone?
So
Can we unmute?
the maximum, sorry.
Okay, you're all answering together. I'll take it to Vineeta. Vineeta, go ahead.
At least 2 weeks for the development of antibodies, and then it will get even better. But until 2 weeks, practically no protection.
So I was just going to say that many people whom we reported on who had died, now we don't know, maybe they had other comorbidities. We don't know. There are many ifs, buts, whens that played out, had got a single shot of vaccine. So now it's the CMC Vellore study, Vincent, on the one hand, the UK study on the other. But even the UK study says 70% efficacy against hospitalization for 1 dose. So that's important to underline. Now, in my last comments, I want to ask all of you, what worries you the most right now? If there's one thing you'd want policymakers, government to be looking at, you've all made the point about citizens and COVID-appropriate behavior. So that's already done. If there's one thing we need to be telling the government to be focusing on, policy to be focusing on, procurement in terms of drugs and supplies to be focusing on, what worries you the most? Arvinder, I'll start with you and we'll take last comments. Arvinder.
I think one thing we haven't spoken about and focused on is the number of people already exposed. So I think there should be a massive sero testing drive, because we've seen in our own hospital that people who have good antibodies, when they're given one dose of the vaccine, they develop, in fact, a higher antibody level than seronegative people getting 2 doses of the vaccine. So if you actually test out
I don't know if Arvinder is trying to say something, but we can't actually hear him. Arvinder, can you hear me? Okay, we seem to have lost Arvinder there, so we'll reconnect with him. And let me ask Dr. Bajan the same question. What worries you the most?
Yeah. So, in just as one thing I cannot point out, but we need to definitely keep on the vaccination drive. We need to unlock very, very carefully, and we need to unlock in different districts differently depending upon the vaccination done there and the case positivity rate. And also, we need to improve our supplies. And please, we must make sure that we avoid super spreading events like political events, marriages, etc. And that's what we should say in a nutshell.
And the Delta Plus is not worrying any of you. That's the intriguing thing. None of you have actually mentioned the Delta Plus as a cause of great concern. Yeah, Dr. Bajan, you want to add to that? And then I'll take it to the
so
others.
basically, the Delta wave is, as we all know, it's the variant of B16172 AY1. So this AY1 is the positive, the plus one. But this plus game looks like more of a Vivo or a Samsung Pro Plus Max variants. I think we should stick to common things that we usually follow to try and prevent the pandemic. The only difference with the plus is that first, UK told us that June 11th was the first time they found the plus variant, the Delta Plus in India. But actually, we have been finding it since the 5th of April. And in 2 months, if we have got only 40 cases, I think we've done well. Having said that, we need to have more of genomics. Now, when we talk about the UK and the US, the UK second, third wave is because of the Delta variant. 91% of them have the Delta variant. In the US, it's a little different. It is not the AY1, but it is the AY2. So I don't know what they are going to name that.
Okay.
So I think these variants are going to keep coming and happening, but we should have our policies in place. And we are much wiser this year than the next. And by and large, if you ask me, the third wave is not going to be as or more significant than the second, but it might be placed somewhere between the first and the second.
Well, something as bad as the second, I think, would be just completely ravaging and scarring for this country. Arvinder, you're back with us. I'm just going to quickly let you finish your point, and then 30 seconds to Shahid, Vincent, and Vineeta. Arvinder, go ahead.
Yeah. So the point I was making was we need to know how many have already been exposed. They may know about it, they may not know about it. And the efforts for vaccination should be focused on people who have not been exposed so far. So there should be a massive drive to test antibodies, which is called sero testing. And generally taken as 15 in case of neutralizing antibodies. Then I think you should be good not to have vaccine for at least 3 months. Or if you have a vaccine, then just have one dose to start with. So that would cut down the number of people that you need to vaccinate in the beginning.
Yeah, I get that, and I the suggestion makes eminent sense. Except that, Dr. Bal, I think you were pointing out in the previous program that you need the world to be on one page for this. If everybody else asks for proof of 2 vaccines, and you say, "Hey, I had 1 vaccine and I've got great antibodies because I had COVID," you're not going to get entry into London or New York. Dr. Bal, your last comments.
I'm going to look at a somewhat distant future. I know from these lessons that our fingers were burnt, and we are probably trying to say various things, including the task force which have been constituted. But what did not get a mention is that for 75 years, we have actually neglected our public healthcare system. And that public healthcare system is in a state of collapse, and having industrial oxygen diverted for medical oxygen, having jumbo hospitals created for temporary housing of the patients, and so on and so forth, is really a short-term solution. And this is I hope this level of pandemic doesn't come back again soon. But various other diseases will come to us, and we do need public healthcare system and very substantial investment into the public healthcare system. And I hope our government actually learns a good lesson from that, and the advisors provide enough advice for that purpose.
Okay, I literally have a minute left. Vincent, to you, and then Shahid gets the last word. Just go ahead. I was talking about the world needing a uniform policy. So, to Arvinder's suggestion that why don't we test for antibodies? Not everybody needs the second dose if they've had COVID. I think it's a great suggestion. But is the rest of the world going to let me as an Indian travel into across the border then?
I mean, that sounds nice on paper, but it's very difficult to implement testing and then vaccinate after that. So I don't think I think we vaccinate everybody with one dose as much as possible. Second thing is, what worries me the most is people becoming complacent and starting to go back to behavior seen in December or November. Make sure we emphasize, we continue to wear a mask. It will protect you from COVID. Even if you get COVID, it will make it milder. And then the final thing is that because of the large population in India, you are always going to have people who come on Twitter or on TV and say they had one dose of vaccine and still got very sick, or two doses of vaccine and still died. That happens because none of the vaccines are 100% effective, but we don't have a sense of the denominator. So we should emphasize to people the vaccines still work. Don't worry about people, some occasional reports or anecdotes that come out like that.
Shahid, one question to you before you close. We still don't know, and maybe you'll tell us one day, what made you resign from that advisory body to the government. Vineeta is laughing. I try my luck with Shahid every program in the hope that one program he'll tell us. But the reason I'm asking is this. We are not doing enough genome sequencing, right? We all know that. Now, given the fact that we are not doing enough genome sequencing, why are we so confident, or why are all of you so confident that the Delta Plus is not something to worry about? Has there been enough sequencing for us to know that for sure as of now?
Well, I mean, for whatever level we are sequencing, we did find Delta Plus, and we found it very quickly. And the fact is that whatever rate we may be sequencing, we are not finding it increasing at a huge level as we saw Delta increase. As far as why I resigned, I think Vineeta was part of the same group, and the two of us couldn't be in the same room at the same time. So,
nice try at humor.
Yeah.
Considering you're both smiling very amiably at each other. So
to be serious, what worries me? What worries me is that we forget lessons very quickly. We were very successful in eradicating polio using very hard-nosed public health and epidemiology. We had no smartphone apps at that time. We certainly had no drones to supply vaccines to rural areas. Yet we conquered polio. I think we need to remember those lessons. And the second thing I would say is looking ahead. I do hope that once COVID is gone, and it will be gone, we will continue genomic surveillance, because there is much more to survey. Animal populations need to be looked at. Fevers of unknown origin in humans need to be looked at, so that we can sense what's coming to us quickly. And India really needs not just good public health system, but also a surveillance system that will also stand up to surges. We have a system, but it failed when it came to the surge. So I think those are the things that worry me.
All right, thank you to all of you, to Arvinder, Vincent, Dr. Bajan, Dr. Vineeta, Dr. Shahid, Jameel. I think the important thing is to show a little bit of humility in front of this virus, and by that I don't mean surrender, but triumphalism cost us before the second wave. So whatever else we do, we should avoid triumphalism. That's the only thing that sort of scares me. That early triumphalism is exactly how we got to the ravaging impact of the second wave. But I'm so relieved to hear from all of you because, just the pain upon pain in homes that one is visiting in one's travels across India, it's almost unbearable to imagine another round of this, even at half a level. Modelers can say 50% less lethal. 50% more than the first wave is devastation for countless homes. So That's just something to keep in mind. Thank you very much. And to our audience, we continue to bring you ground reports as we travel across India, fervently hoping that what our panelists have said today is correct, that the third wave, as in when it comes, may not bring with it the bad news that the second wave did, provided at least we as citizens keep our end of the bargain. That's all we can do. Thanks for watching. See you tomorrow.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.